many parents are concerned about ADHD. They don't want to put their children on Ritalin. How can that be prevented?
So, to begin with, the prevention of ADHD really begins with healthy prenatal care and healthy infancy, which would certainly include, a healthy diet for the mother during pregnancy, omega-3 fatty acid supplementation, which is needed for optimal brain development. It's actually been shown that mothers who have a higher omega-3 fatty acid component in their blood are that their children are actually smarter.
Smarter.
On average, yes.
Okay.
On average, you will have a smarter child if you take omega-3 fatty acids
All right.
while you're pregnant.
That's all we need to hear.
So there you go. So that's the first step, is healthy brain development in the womb.
All right.
Continuing healthy development in infancy. So that would include breastfeeding, again, a nutritious diet, because the nutrition that the baby receives is going to be the nutrition the mother eats. So healthy diet for the mom, healthy nutrients for the baby. Including, continuing with the omega-3 fatty acid supplementation in the mother throughout breastfeeding. And then into childhood, not exposing your children to a lot of heavily pesticided foods, artificial colors, artificial ingredients is going to be the next key. Another component is intestinal health. Our intestines actually produce more neurotransmitters than our brain. The nervous system that runs along our intestines produces more neurotransmitters than our brain. So our intestinal health is incredibly important in our overall health, our mental function and well-being as well. And one of the components of intestinal health is a healthy population of flora. Our gut is actually populated with more little microorganisms than there are cells in our body. Huge population that's living right inside of us. So changes in that population can make an incredible difference in our overall health and well-being. So things like antibiotics can be a problem because they kill off that population, and then you have the potential for repopulation with the wrong sorts of microorganisms that can cause inflammation and then lead to poor neurotransmitter function and production. So, making sure that if your child does need to use an antibiotic, that you're eating good cultured products such as yogurts and replacing those flora with probiotic supplements can be very helpful.
So these suggestions can help prevent it.
These suggestions can help prevent it. And they're also a starting point for treatment. So typically when I see a child with ADHD, I'm going to ask about history of antibiotic use, diet, and about their symptoms, their GI symptoms, because that is so important in preventing and treating ADHD. That's one starting point that I'll often approach treatment from.
Well, thank you for that explanation.
You're welcome.